think for a minute if it was your family member, right? You want to have the best interest of this person, this injured person, this disruptive time in their life. You want to have what's best for them. Don't rush through it. Don't try to have a favorite item or brand or whatever that you'd like for them to use. Find out what's most important to them, what's the best fit for them, what makes most sense for their lifestyle, as we touched on. What a thorough understanding with everybody involved, all the shareholders involved on the claim.
Welcome to another episode of It's Settled, the Amitros podcast, where you'll hear authentic stories of overcoming adversity after a life-changing injury and how injury survivors, members, and industry experts are making a difference. I'm Andrea Mills, Chief Client Officer at Amitros.
And I'm John Kane, Senior Vice President of Strategy. If today's episode inspires you, please subscribe and leave a review to help inspire more listeners facing similar situations. Now, it's settled. Let's get on to the episode and explore the human side of workers' comp and insurance claims. Today's guests are from HealthBridge Medical, and we have Ted Thomas as well as Edwin Hernandez, and I'm going to let them introduce themselves and talk a little bit about durable medical equipment. Gentlemen?
Great. Well, I'll jump in first since you said my name first, John. Thank you. This is Ted Thomas. I'm the Chief Revenue Officer for HealthBridge Medical. I've been in the managed care industry for about 25 years. So I have a pretty good feel, I think, for many aspects of it, right? The case management, the DME delivery, all those types of things. So HealthBridge specializes in nationwide DME delivery of all those products and services and home health services. So.
Hey, my name is Edwin Hernandez, founder and CEO of HealthBridge. Started HealthBridge in 2011. I've got a background in diagnostics, specifically neurodiagnostics and ultrasound imaging. Became interested in DME, in the DME space back in around 2005 when became intrigued with the rising cost of products and services and access to products. And then the lack of effective communication between parties that were involved in the cases, and that's what brought me to the work comp space.
I would add here, as we're getting started. We know it's a very disruptive time, right, for the injured, for the claimant or the member. So we really focus on just doing every time we touch them that we can make their day, make it a positive interaction. Our team we train our team a lot on that. We have formal training on that. We also talk to our technicians that are actually in the claimant's or the member's house again, think about if this was your family, how you would like somebody to come in and deal with this. They're probably overwhelmed. They're not sure, what to do, who to talk to, who to trust. So we just really emphasize on, maybe they just want somebody to listen, right? We just really emphasize on listening to the injured, making them as calm as possible, helping them through the process, helping them with maybe some decisions on certain items, and at the end of the day, really just making them that they know they have a trusted partner in HealthBridge.
And I'll piggyback off of that. Ted, you brought up something that we see here quite often, and that's we have claimants that will call and spend quite a bit of time with some of our associates. Some folks might frown on that because it's taking time away from the efficiency and internal efficiencies that within the business. But we actually embrace that because it allows us to build a relationship with those patients. A lot of our claimants are long-term care cases that we know we're going to have a lot of communication with, and part of building that trust is make time to have a conversation, whether it's about the care or just a conversation related to family. And I think that helps us. That helps not only our team get to know the patient better, but it builds comfort between the patient and our care coordinators.
It's certainly a life-changing event when the person, is injured and they go on to a workers' compensation system that they're not familiar with. With catastrophic cases, they have, an advocate, that is a nurse case manager that helps them, through the process. I think it would be helpful for the audience in terms of, the durable medical equipment, especially in catastrophic cases. What type of needs does the individual have?
Yeah, needs can be they're very broad. One thing about the DME space is that you've got anything from simple to complex in order to determine what it is that the patient is going to require for their transition to the home or within the skilled nursing facility. Is dialogue between the provider and the referring parties. I think our team, we might see a prescription that is and sometimes they're very, very broad, very vague. What we do is we have direct communication with the referring party so that when those products are delivered, exactly what the doctor expected and what the patient was expecting as well.
And you talked about trust, and it's really a partnership, and not necessarily a vendor with the injured worker. They want to make sure that their supplies are delivered timely, and that there isn't a disruption with their medical supplies. How do you make sure that the supplies are delivered timely?
That goes back to having that communication, open communication with the claimant. A lot of times, what we do is once we know there's going to be a recurring order, we have not only do we communicate with the payer, but we also have a discussion with the claimant to make sure that we're meeting their expectations. Last thing we want is the last minute rush on a Friday for product that a patient is in dire need of because they're down to their last catheter, for example. And now they live in a rural area where you don't have that Saturday delivery option. And now they have to wait until Monday. Well, we know what that can turn into. Making sure that we're communicating with the claimant often and make sure that we set a tickler maybe a week in advance, right, to that last day of the month, to make sure that if the patient requires not just the products are recurring, but they might need some new products that we're unaware of. That helps us to be able to communicate that back to the payer and then keep on pace with the recurring items.
One of the things that we talked about this morning is some of the surveys. So once we, onboard an injured worker post-settlement, what are some of their concerns? And part of it is understanding what's Medicare covered and what's not Medicare covered. If you could give a couple examples of, what would be covered versus non-covered, like maybe a shower bar or something like that.
Yeah, we do hear that a lot, and unfortunately there's no fee schedule, for instance, to be able to apply to those products, right? So there's just random products, and I'll give you an example. Medicare doesn't have a code for a stylus. They don't have a code for let's say a clothes hanger, right? But they do have codes for a cane and a walker and a wheelchair. And so those are treated on a case by case. They don't have necessarily a cost there's no fee schedule applied to those. So for us, it's coming up with the right solution from a cost perspective with our client to make sure that they feel they're getting a fair price, and that the claimant feels they're getting a fair price as well.
Yeah, I would add that, many times when the request for service comes in, right, our team's really trained to they know the type of injuries that perhaps a certain brace is being requested, but we think another brace would really work better, right, within the parameters of the script. So we talk to the patient and get more information, and that has helped a lot toward making sure the right item goes out. The first time there's not a lot of back and forth. Again, the family setting's not disrupted or anything. So that's something that, again, very important to us to kind of get more specifics on the injury the claimant has.
Yeah, let me expand on that, Ted. So Ted brings up the option within the parameters of, and I'll use a knee brace as an example. Oftentimes we'll get a referral for a generic versus brand because we've had so much experience with these product lines. A lot of times we'll see a generic, which, by the way, will be coded regardless of if it's an L1833 as an example for a post-op knee brace, whether you get a generic or a brand, it's going to reimburse at the same rate. We usually choose, unless we're asked not to, we will choose the brand. It's not going to cost anyone any more. And the reason we do that is because we know that the product's made is made better. We know we have access to a part for that product if it's required, and it's more durable. That means that the claimant is not going to have to pay for an additional brace 6 months down the line because it ripped apart. So there are benefits to being able to look at a script and maybe not necessarily question the reasons why it's being prescribed, but maybe look at another product within those parameters so that we're providing quality and the patient is happy with the product they're receiving.
And that goes back to communication and having empathy and compassion. Especially for someone that, requires a knee brace. It might be, a hospital bed. But, most of these people are significantly injured and, they want to be listened to. I don't know if you have any, further examples on that.
Yeah, we, with regards to the transition to the home.
Yeah.
Yeah, it's, their life is disrupted by this catastrophic event. And then they're being taken care of. It could be 2 months, it could be 6 months, taken care of by folks in a facility. And then there's the transition to the home, right? And while we sometimes think the transition to the home is something that's going to be easy for the claimant because they are going back home, there's a part of them I think that I feel, because I've been in the care of a hospital for 6 months, so that transition to the home is impactful, and the reason and why that is because you were injured, you went to a facility that took care of all your needs, took really good care of you, brought you back to health, and now you're going back home where you're not going to have the same care, perhaps not by the same folks. You become accustomed to that environment, to that type of care, and to those people that you're familiar with. And when you go home and all of that changes, while it's still home, you feel out of sorts, and it becomes sometimes it's a bit uncomfortable. It's important that the patient feel that they can trust that transition to be safe for them and the folks that are going to be involved in that transition as well.
Yeah, John, another aspect to your question, it's education not only with the claimant, right, but with the family members or whoever else is involved here. Maybe it's a neighbor, maybe it's somebody just comes over occasionally, right? They need to know the nuances and subtleties of the items. Maybe they're complex items, maybe they're simpler items, but this needs to be changed, whatever, every couple of days, or need to do this or that, right? We make sure that we know the entire situation there with the family members that are involved, and we make sure that they get educated on helping the injured, again, so everyone feels safe and secure with this new change in their life. Right.
I'm sure there's, a home assessment before the discharge to take a look at the house, make sure that, if there's a wheelchair involved, that, there's a ramp, and that, the home is accessible.
Yes.
I don't know if there's anything else to add to that.
I think it's important that the home assessment is done prior to, and sometimes you can't help. There might be a situation where the chair comes before the ramp, or the ramp comes before the chair. But sometimes what we've seen is if there's not coordination between the groups that are providing the equipment and assessing the home, you might have a situation where, as an example, you've got a patient who they put a ramp they put a ramp up to the home. It's fixed. It's the patient then arrives to the home with a chair that's 2 inches wider than the ramp. Now you got a problem.
Yeah.
So I think coordination between all parties involved is extremely important. I can't tell you how many times I've seen it where the parties they don't have a discussion between themselves to make sure that transition is seamless.
Yeah. There's something that both of you said that I want to go back on to, or go back to rather. And when you talked about it with the parts, and then Ted, I think you talked about it with like making sure it's the right, piece of equipment for that person. Because I often think about my parents, and my mom has had some, medical needs and durable medical equipment needs kind of, of late in the recent years. And I think sometimes people, and especially when we think about professional administration of that member's funds on our part and making sure that they're spending their money the proper way. I also think people sometimes want that Cadillac piece of equipment, but maybe because of their technology challenges, or just maybe, Edwin, to your point about, that chair doesn't fit that ramp, et cetera. How do you all think about making sure that you're giving that person like the right equipment based on their lifestyle? And then also, Edwin, you made a good point about the parts and making sure that you're getting a piece of equipment that the parts will be available for. I think those are really two interesting pieces that I'd like you guys to go a little bit more in depth on.
Yeah, and I can certainly do that. So HealthBridge has direct contracts with 200 manufacturers and distributors. So we have access, speaking to, let's say, power chairs as an example, we have access to many brands. And some of those brands, they're side by side. The cost, there could be a huge cost difference with the same type of technology. So they're both equal in technology, right? And then you have some that if the patient does not feel comfortable enough with technology and they don't want they don't want the Cadillac, they still want the functionalities, but they just don't want all the bells and whistles. There's options for that as well. One thing that we think about when we provide equipment is, can we service that equipment once it's placed in the patient's home, which is extremely important. 2, cost management for that product. And 3, how readily accessible are those parts? Because if there's any issue at all with a tire, for instance, on a power chair, or a power elevating leg rest, or an actuator, we're still we still see from time, well, with some manufacturers, not all manufacturers, it's certainly gotten a lot better. We're still seeing a lack of access to product, to parts, for instance. So we really look at those products first that are going to be that we can easily repair, and that the parts are readily available. So it's part of the package. You can't just look at cost for product and providing the Cadillac. You've got to look at the full picture, right? And that starts with the prescription, the patient, what those needs are, the client needs. So you've got to look at the total picture. Our team does a great job of making sure that whatever product we put in the claimant's hands, we're able to service it, and that those products, those parts are readily available.
You don't want to have the equipment end up in a closet and not being used. You want the DME equipment to be functional for that individual.
That's right. Yeah, and I'll tell you, if they don't feel comfortable using the equipment, and I've seen this in the past as well. I've walked into a claimant's home where they've had several wheelchairs, custom power wheelchairs and custom manual wheelchairs. The reason why they're sitting off to the side is just they're not easy to use. Great technology, right? But they're not easy to use, so they put it away and they just look for something that's easier for them to operate. And so you end up spending a bunch of money on equipment that's going to collect dust.
Yeah. It's understanding the injured worker's needs and what they're really going to use.
Is there anything that you're seeing kind of in the marketplace that's new for DME that we should be aware of? That's kind of some hot new items out there?
We're starting to see more and more air fluidized bed systems, not necessarily fully integrated, but we're starting to see that more and more because there's a brand in our space that has gotten out of the rental model. And so they're not only are they not renting not only are did they get rid of the rental for the home environment, but most of their beds don't fit well into the home environment either. Very large beds, very heavy beds. So we've had many claimants who live in a trailer, and when you've got a piece of equipment that weighs anywhere between 500 and 600 pounds, maybe 700 pounds, it's not going to work well in a trailer. So you've got to get something that still provides the same clinical advantages, but not necessarily something that's heavy or not fitting for that environment. We were able to offer our clients options where before they didn't have options. I've also seen some new technology, great technology actually, that's come out for power assist for custom manual wheelchairs. Custom manual wheelchairs, and I'll tell you why I think that's so important, is because there once upon a time you had only the option of operating a custom manual wheelchair with power assist by still using the arms, the shoulders, and you know after a while power assist was out is because it's less cumbersome for the patient. It's easier for them to navigate, and it's less stress on their shoulders, right? So when you look at some of the power assists that's come out that are adaptable to most of these custom manual wheelchairs, there's less and less stress on the patient's upper extremities. So for many years we've had maybe one or two options, and now we're starting to see 3, 4, 5 different options out there that are coming out. And some of them are they adapt right to the front of the wheelchair, and so you hold on to it no differently than you would a bike. And the front wheel basically it connects to the wheelchair with a front wheel, and it's battery operated. They're able to navigate just about anywhere. So there's that sense of independence too, right? Because it's super important to the claimant. They don't want to be pushed around all day long or feel like they need to lean on someone. So I think what comes to mind right away are those two. Ted just brought up wound care. It's not necessarily that technology has changed, but there are some other options out there, so you're not necessarily stuck with one particular brand. And so I think from a cost perspective, it's also been extremely beneficial to our clients too to have those options.
Right, that one brand, for a few seconds here, is very expensive. So it would be of great interest to the members to have other options there on that brand, the negative pressure wound therapy items.
When there's new technology that comes out, like the bed, like a hybrid wheelchair, are there any delays by Medicare in providing coverage for those new items?
As long as you have supporting documentation, okay, supporting the equipment and the needs, there shouldn't be a reason why it's not covered.
So it sounds like, with the bed and type of the injured worker, are we talking about, paraplegics, quadriplegics, folks that might, be in the bed for a long, extended period of times that could develop bed sores, and that's why, we're looking at these specialty beds?
That's correct. Yeah.
Yes.
Some claimants, and I'll tell you, some claimants, they don't embrace the air beds because it's not I wouldn't say it's not comfortable. I've tried those out many times, and some are better than others. But that immersion into it, because it's an airbed, and it's not meant to be at max inflate and on the more stiffer side. I think it makes the claimant just doesn't feel that doesn't feel good to them. The downside of that is when they don't like it and they transfer into an everyday mattress, they're going to develop wounds, right? And so ultimately they're going to be back in the full immersion in the airbed that they're unhappy with. There are some products out there where you're not getting that full immersion. They've got great case studies behind it. They've got mattresses with air cylinders in them they provide the same type of air that skin management, and they have all the properties that you would see in a low air loss mattress without the same without the air pump running 24/7. So which is can be also a deterrent to them. They don't like to hear an air pump running all day all night. It still provides wound management, and these mattresses, if the physician and there are times where we offer that as an option, because we will get those claimants that say, I've been in an air mattress before, I don't want the pump, it's too noisy, or it rattles my bed, or the mattress just doesn't feel well. These beds are designed to give you still give you still provide the efficacy, but they don't have the same you're not immersed in the bed, so they're not as uncomfortable. They're very supportive. They've got air cylinders in them. They provide alternating pressure management, and they've got convoluted foam, which is not rigid. It's quite comfortable, and so they're very receptive to those products as well.
It sounds like a lot, in terms of understanding, the needs for the patient. I would imagine if, a family was trying to do this, where they settled out their case and they're trying to self-administer their case versus having, support behind the scenes, like professional administration, where we have, DME specialists that work with companies like yours, helping out. It must be challenging for the family.
It can be challenging. That when they come back home, they've got so much to worry about, right? Settling in. And while you might have some boots on the ground to provide that support from a technical perspective, it's sometimes very difficult for them to take all that information in, store it, keep it for use later, right? We're always available. So our team's available 7 days a week, 24 hours a day. And so if there are any questions related to how a product works, or even some challenges as to how the product works, in the case of a low air loss mattress, how to program it, if there's a leak in the mattress and they need assistance right away, we're only a call away.
But managing the entire process, I think, right, is really key. Not just making sure they got the right item, but many times they won't know what they need next or who to contact next. And we can certainly, help with directing them, listening to them and get them moving down the path that they need to go down.
And thinking through, here at Ametros, we're thinking about what happens post-settlement and that people are going in for surgeries and they're scheduled, and we kind of know that timeline and that time frame and kind of what will be needed a little bit after the fact. Sometimes, there may be surprises, or there'll be things that maybe the doctor's prescribing because they need it and we didn't know about it ahead of time. But, pre-settlement, what's also like a good time frame for you all to be notified either of like discharge, or they're going to be discharged either from a hospital or from a long-term care facility and going home? What's kind of the sweet spot of like notification to you?
I'll jump in on that, Edwin. The sooner the better, Andrea. I mean, if we could get at least 72 hours notice, but more notice than that will work better. And we can make sure that the proper items are good that are being requested are the ones they really need. We can make sure that's there and meet, the time frames necessary to maybe move on to the next item. We can avoid unnecessary costs for the members with extravagant shipping cost and a lot of last minute drop ship things that if we have at least 72 hours notice, we can avoid almost all those things.
And I'll add to that I'll on two fronts. So we'll talk about supplies first. Many times we'll get a prescription for supplies for a patient. It'll be a very large list, right? What we've been able to do, and our clients have agreed in working with us and getting those products, at least a handful of those products. So in other words, if you've got a patient that requires, let's say, 300 catheters, rather than sending out 300 catheters and overnighting those 300 catheters, we send them out what they need for the next few days, then get the rest of the case out to them ground shipping to avoid those overnight next day air costs, which, as Ted said, they're extremely high. So that's one. The other is 72 hours is great. When Ted said a little, even longer would be better. That's particularly important when the patient leaves with prescriptions for custom products.
Mm-hmm.
Physicians will write out prescriptions for a custom RAS. I'll use a RAS shower chair, for instance, rehab shower chair. Well, a RAS rehab shower chair cannot be shipped overnight. You've got Activate, who their products are made to order. So made to order means that it's 5 to 7 days minimum for them to go through production, and then they need to ship, and they're bulky. So overnighting something like that is going to cost you an arm and a leg. For us, on the custom products, I would say if you've got about 2 weeks notice, if we can get, particularly on the custom products, on the heavy lifting, and that would be like the hospital beds, specialty hospital beds, lifts, that sort of thing, we would want more time because we want to coordinate either with the manufacturer who we're getting the product from, a technician on the ground is going to be receiving the product so they can coordinate with the family, the delivery and the setup. Or if you've got custom products that need to be managed, that are going to be managed differently, we also have some opportunities too with certain manufacturers to be able to get them to maybe process something sooner for us, but it's very rare because everyone's after the same thing. They want the product yesterday. But there are times when we might be able to pull some strings, but it's rare. So with the custom equipment, it could be a little more challenging, and so 2 weeks would work well. For the supplies, the easy drop ship, I would say within 72 hours is very fair.
That makes a lot of sense. Just out of curiosity, why would you need a custom shower chair versus the old plastic and metal ones that I feel have been in my grandmother's house for years?
That's a great question, and that's because if you have a paraplegic that requires a bathing system like a rehab shower chair that tilts back for hygiene, and they cannot manage their baths themselves, or they can, and they use the shower chair to get out of bed into the shower chair and into the shower. These claimants are going to require some type of tilt, or even if it's not tilt, some type of rehab shower chair. These rehab shower chairs come with a special seat. They call it keyhole, and basically have openings either to the right, to the left, or in the front, and that's for personal hygiene. So there are a lot of advantages to a custom rehab shower chair, or just a rehab shower chair in general.
Gotcha. That makes a lot of sense. Interesting. I think also one other thing I was curious about is if I'm a new claims handler listening to this podcast, or I'm a new employee to Ametros, and I'm dealing with, an injured worker that's getting discharged, or an injured worker coming home from surgery and needing equipment. What are some tips you would give that adjuster for, let's say, empathy and checklists and things like that?
I'll jump in for a second, Edwin. I think it's a lot easier when an adjuster can go to one resource to get all the items they need, right? Because then if you don't, you're managing multiple resources and you don't remember which which partner told you which item was coming in earlier, which item still needed to be delivered. So a big tip I would give for an adjuster just starting out doing this is, find organizations that you trust, that are going to do a good job for your patient, have the experience, and that can get as many of those, access to as many of those discharge items as possible. Then you just have, one group to interact with to make sure that all those items are either being delivered or on their way to being delivered. So great, but much better use of the time for the adjuster.
Awesome.
So Ted and Edwin, we've been talking a lot about, the equipment, safety, making sure, if it needs to be customized. There's a lot to this. And I'm sure with like wheelchairs, especially with people that, might be morbidly obese, that there's fittings that are associated with that. Can you talk a little bit about, the customized and the fitting behind the equipment?
Yeah, so it's not a one size fits all, so you do have to have an assessment. It would require an ATP, and perhaps even an OT if they're involved in the patient's care as well at the facility. Coordinated visits so that the ATP could be on site, measure the patient, maybe even have a sample chair. If we have the patient's height and weight, we might have a chair, or the ATP might have a chair that they can bring out and show the features and benefits to the claimant, kind of explain exactly why they're being fitted for the chair. And so the post fitting is just as important too, because the fitting of the actual fitting of the chair is where you make all the necessary adjustments. One of those adjustments would be the bucket, creating bucket in the chair, and that's the drop in the back of the seat where the patient, when they sit down into the chair, they're sitting in comfortably into the chair. And so that fitting after the chair has been delivered by the ATP is extremely important, if not just as important as the actual first visit where the measurements are taken.
And for our listeners, ATP?
ATP is short for Assistive Technology Professional.
Thank you. I appreciate it.
Yeah.
So it sounds like it's, a lot of work to make sure that the person is properly fitted and, they feel safe with the equipment, as well as, we talked about making sure they're using it, right?
Correct.
I would just sum up our approach, and whoever is dealing with the claimant is, just think for a minute if it was your family member, right? You want to have the best interest of this person, this injured person, this disruptive time in their life. You want to have what's best for them. Don't rush through it. Don't try to, have a favorite item or brand or whatever that you'd like for them to use. Find out what's most important to them, what's the best fit for them, what makes most sense for their lifestyle, as we touched on, what a thorough understanding with everybody involved, all the shareholders involved on the claim, get all that information up front. John referenced it earlier about making sure we ask a lot of the questions up front. Well, that's exactly what you need to do, and you need to listen. And again, not one size doesn't fit all. This is very nuanced things that you do up front, and it takes a lot of experience, right, to make sure that you're listening to the keys and the clues that are being told to you to make sure that you get out the perfect item for this person, for this injury.
Ted and Edwin, we certainly appreciate, your information, the insights, and, how we can make this easier for, the injured worker with respect to their DME and a safe return home. So, on behalf of Mitros and It's Settled, thank you very much. We appreciate your time.
We appreciate it.
Thank you.
Thank you
both. Thanks for listening to It's Settled, the Ametros podcast. Find us on major streaming platforms like Apple Podcasts and Spotify. Your review means a lot to us. It helps us share these inspiring stories with more listeners. For more information about Ametros, please visit our website at ametros.com. That's AMETROS.com.
And a big shout out to our amazing guests for sharing their experiences, and to our dedicated podcast producer, Melanie Samaran. Join us in our next episode for more uplifting stories. It's settled. On to the next time. Stay inspired and continue making positive impact.